Hello. Hi, Gail. She's way. Good morning. How are you doing? What's going on? Let's let people arrive. Make sure everything is where it should be. Any questions today? Any comments? Let me know before we get started. Let others arrive. Nice to be here today. Looking forward to this practice. Let me make sure you could hear me and see me. So can you let me know, those of you that are here, can you let me know if you could see me and hear me, please? So Gail and Cheeseway, can you hear me? Can you see me? Perfect. All right. So I don't know how that worked, but it did. All right. Let's get started. Yes and yes. Perfect. All right. Well, if there aren't any questions, I'm going to go back to my mat and begin. It's nice when we do the practice to have an intention or to have a focus, because then it's like a map of where are we going. And that's the way that I approach the practice when I'm doing it myself. And it's also the way that I approach the practice when I'm creating a practice for others. So today's focus, I chose the topic stronger bones and joints. And I'd also like to put in there stronger muscles as well. Because here's the thing that's important, is that when we get a diagnosis of osteoporosis or osteopenia, we think bones, just like, let me get stronger bones. But there's a lot of factors to that. And one of the factors for healthy aging and actually for happy aging is that you have strong joints, mobile joints, because that's where pain and discomfort shows up the most, is in our joints. That's where arthritis, pain happens, a lot of degeneration of knee joints, of hip joints, and of the spine. And so if we think about the joints and we think about strengthening them, which is what we're going to focus on today, this will be our guidepost. This will be our direction for today's practice. All right, I see a couple of others entered, and I just wanted to see if there was any questions. Hi, Jean, Terry, so good to have you here. And Diane, nice to have you. Any questions before I begin? Or any comments or anything like that? All right. So with the intention in today's practice being the stronger joints, there's going to be some emphasis on holding the postures and on making sure we're bending correctly in the joints. That's what's going to give us that stimulation to the joints. Either we keep them in a straight position, so we keep the arms straight, so that would be no bend in the elbow, or we can actually challenge ourselves with the elbow bent. And what this does is does different things to the muscles. The muscles have 3 different ways that we could strengthen them. We can strengthen them in a lengthened way, which is an eccentric. We could strengthen them in a shortened way. So if you're doing this, your bicep is shortening, then this could be a concentric strengthening. Or we could do isometric, where the muscle is in its natural state, and then we apply forces to strengthen the muscles. So today in our practice, we'll move through those different areas. We're going to do lengthening, strengthening, shortening, strengthening, and in the natural state, we're going to strengthen the muscles and the bones and the joints. For the practice, a strap, a block, a blanket, and then at some point we may need a wall or a chair, so make sure you're prepared before we begin the practice. We're going to begin by doing a little manipulation to the spine, the upper spine, because this rounds throughout our day. all of us, no matter how aware you are, I spend a lot of my day focused on realigning my spine and my posture, yet we always can do some work in this area. So I'd like you today to take your blanket and fold your blanket into thirds. Now, depending on the weight of your blanket, this may be a pretty big fold. In terms of the space, try to get it to be that it's not too big of a space when you're folding it. So if you do have a really wide blanket, maybe in fourths might be better for you, so you get a little more narrow. And then we're gonna come down onto the ground. So first I want you to move back and forth to feel your buttocks here, really getting familiar with your joints, with your bones, with your muscles. And then we're gonna use our core and the strength of our core, depending on where you are today. Imagine that you were zippering up tight pair of jeans. So you're really contracting your core as you lower down. If you hold on, that might be easier for some of you. Make sure you're maintaining a safe spinal space, not crunching the front of your spine. So looking forward and looking up, you either hold on or not. It depends how much strength you have in your core on how you lower down, and be okay with whatever it is. Start with knees bent, have your feet pretty close to your body. And then the blanket is gonna go underneath your heart. So move in a way that the biggest area of stretch is in the heart. Keep your feet close to your body and your knees bent. That will minimize the pulling action on the lumbar spine. We are manipulating the 12 bones of the thoracic spine, and that's going to translate down to the lumbar or up to the cervical. So see for you what is appropriate, and take your arms up and open to the side. Lift your head, lengthen the back of the neck, tuck the chin down towards your chest. Feet a little wider than your body, knees fall in towards each other. And then just pay attention here to what's happening. So this can be a very big opener. It's a very small fold of a blanket, yet we're manipulating a part of the spine that's attached to your rib cage. And so there's a lot of sensory pulling that you may experience here. And then you move your arms up higher, and that actually starts to stretch the armpit area and starts to do a little bit deeper work there. And then notice what's happening in your neck, because you are having an effect on the spine above and the spine below the ribs. So lifting your head, lengthening your neck. Just come here with the mouth closed, breathing in and out through the nose. With the eyes closed, noticing where this is showing up for you. Where do you feel the stretch? Do you feel the same stretch on the right side of your body that you feel on the left? And then do you feel anything in your lumbar spine, the low back area, or in the cervical spine, the neck? And if you do you feel it on both sides? Let's bring a little bit of movement into the neck and into the low back. Beginning with the neck, the back neck is nice and long. Take an inhale. As you exhale, slowly let your head move in one direction. Only your head is moving. Let it go as far as it will. Feel the stretch wherever it occurs for you. Inhale back up to neutral and exhale the other direction. So your head should be on the ground unless you needed to put some small amount of blanket under it. And the shape that you'll feel your head making is a rainbow. As you go side to side, not lifting your head up and turning it, but letting the weight of your head go side to side. You're making a slight arch shape with your head. And then try to go a little farther so you feel more of a stretch. Maybe you feel that stretch that comes all the way up to the skull where the muscles attach to your skull. Maybe you feel this all the way down in your back. Each person is different. Warming up the muscles that support your head throughout the day. And then bring yourself back to center. Let your awareness go to your upper back and neck. Now we're going to do a little tilting of the pelvis to help bring blood flow to the low back area, to mobilize the lumbar spine, moving it from the extension curve, the curve it normally is in, to a flexion curve, trying to flatten the low back to the ground. So let your knees point up towards the sky, be a little bit wider than your body. Take an inhale. As you exhale, tilt your pelvis back. You try to flatten your low back towards the ground. Try to rock back so the top edge of your pelvis touches the floor. And then inhale slowly to rock forward so that you rock towards your tailbone. Your low back is moving away from the floor. Your pelvis is staying on the floor. You're not lifting your pelvis up. You're tilting your pelvis back on the exhale, like you're zippering up tight jeans and you're pulling your tummy away from the zipper, flattening your low back into the ground, and then rocking towards the edge, tailbone edge. Moving slowly here, exhale and inhale. Let your mind go down to your lower body. Do you feel the belly stretch? Do you feel the low back stretch? And when you come into the posterior tilt, flattening the low back, do you feel that all the way up, that movement up towards your under armpits to your upper chest? So lubricating the joints, lumbar spine, cervical spine, and then the thoracic spine is getting stretched in the front. We're introducing an extension curve when it normally lives in flexion. So doing a lot of spinal warm-up in this beginning posture. Chest expansion. And then one more. Bring yourself back to neutral. Take your feet wide as your mat. Soles of the feet are on the floor. Kneecaps are pointing up towards the sky. Exhale. As you inhale, let your kneecaps turn towards one direction. Keep the soles of the feet on the floor. Feel the body weight rolling towards that buttock. Feel the opposite side stretch, maybe even low back involvement. That's your inhale. As you exhale, protect your lumbar spine. Contract your core like you're zippering up tight jeans, trying to flatten the low back into the floor to come back up to center. Inhale, let your legs go in the other direction. Keep the soles of the feet on the floor. Exhale back to center. Inhale the other direction. Now let your head go the opposite direction. Go slow. Exhale, contract your core to come back to center. Inhale, other direction. Warming up your spine, warming up your torso, warming up your hips. Exhale back to center. This could be deep and slow, doing this with awareness.
And then bring yourself back to center. Take yourself into a fully outstretched position. Go slow. Straighten your legs and your arms, moving in whatever range of motion is appropriate for your body. You know what issues you have in your tissues. So move slowly with awareness, eyes closed, be in your body. Fingers reach tall overhead, toes reach tall. Feel the belly stretch here as you draw the rib cage away from the pelvis. Take an inhale. And then exhale by reaching through the heels of your feet and the heels of your hands. Go into the back of your body here. Reaching through the heels of the hands, heels of the feet. Take one more breath. And then go ahead and bend your legs. Take your legs wide so they're all the way off the floor. Lift your pelvis up and pull your pelvis away from your rib cage. Tuck your pelvis under so the low back presses into the ground. Noticing how that feels in your body. And then from here, we're going to go a little wider with our rotation. So we're manipulating our thoracic spine. Paying attention to your lumbar spine when you let your legs go to the side, because there's going to be weight moving away from your body. You need to protect that with your core. So zipper up a tight pair of jeans to bring yourself back up to center. And then let your legs go in the other direction. Exhale to come back to center. Inhale into the posture, moving your head in the other direction. This is a twist. And then exhale, come back to center. Inhale the other direction. Head goes the opposite of your legs. Arms could be straight above you, or they could be bent. They could be out to the side. It's your body. So find what feels the right movement patterns for you. We're in the low back. So if the low back is going way too much into a deep extension curve, push the belly towards the spine and the low back towards the ground. It'll limit your range of motion to go side to side, but it'll keep your back safe. So feeling your body, what is safe for you? Warming up the torso, warming up the hips, the pelvis, the spine. And then one more each direction. And then bring yourself back to center. Bring your feet close to your body. And then roll onto your side. Come onto your side. You could stay on the blanket, but support your head a little higher so it'll bring your spine to a different curve. Get relaxation to come in from that deep pulling and stretching we were doing. And then take your hand, put your hand on the ground, push away with your hand and your elbow to bring yourself up.
Checking in with how your body feels, especially the low back. There's a lot of manipulation there to the low back. You may even notice a lot here in your shoulders and in your chest. So noticing what you notice there. And then let's change our blanket. So bring your blanket underneath your knees. And then see what you need for this. So you may need to support your knees a little bit more. You know yourself, you know your body. And then I want you to lift your head and look forward and crawl. So crawl forward on your mat, crawl backwards on your mat. Keep your head active. Don't let your head hang. If your knees are not happy, you could crawl around on your blanket or any other support that you need. You could even move off your mat if that's okay for your body. Keep your head elevated here as you crawl around, lubricating and settling and setting lots of the joints of the body. So moving around, these primitive movements, really important for our joints and for our alignment. And then bring yourself back to center. Bring yourself all the way up here. Take your fingers, move your fingers. Make sure you're bending all the joints. There's a top joint, a middle joint, and a bottom joint. So really get active in your fingers here, moving your fingers. And then your wrists. Move the wrists. So try not to move the arm. Let it be this wrist that's moving. So we're not going like this. You go like this, mobilize those wrists. Now your elbows, bending your elbows. Let your hands come up to your shoulders. Let your fingers come up to your shoulders. And then if you have shoulder issues, lowering the arms may be better for you. And then if you want to be a little higher, you're doing some shoulder strengthening here, some posture strengthening, upper back strengthening. And then bring your hands onto your shoulders. Now we're going to move the elbows up and down, moving the shoulder blades up and down the back of the body. So this is the whole shoulder girdle, clavicle bones, scapula bones, arm bones. Getting some fluid and some warmth to come into your body. Bring your elbows up, bring your elbows down, bring your elbows forward and push your elbows forward so you feel the pull in the back of the body. Let your chin follow your elbows as your elbows go up. Once you go as high as you can, take them as wide as you can. Let your head come back to neutral. And as the elbows go down, let the chin come to the chest. Let's use breath. Inhale, open and up. Exhale to come back to center and down. Let your head bend, your neck, your cervical spine, stretching the upper back and neck muscles. Keep your teeth together. And then one more. And then bring yourself back to center. Take your hands down alongside your body. You're going to inhale up, really reach and stretch your fingers, moving the shoulders now. Let your fingertips reach the sky. Draw the rib cage away from the pelvis. Stretch your body as much as you can. That's your inhale. Your exhale, you turn your hands out. You reach up and wide. Lengthen the back neck. Tuck the chin down towards the chest. Warming up shoulders, warming up muscles, warming up the spine. Inhale up. Exhale down. Bringing yourself back to center. Let's inhale, the arms are open. Stretch the chest, stretch the shoulders. Feel that in your armpits. And then exhale to hug yourself in a neutral spine, no rounding of the spine. Inhale to open, to receive. Exhale, hug yourself. Feel that stretch in the shoulders, in the chest muscles. Make sure you're not wearing shoulder earrings. So don't have your shoulders up. Lower your shoulders when you do this. You exhale to hug yourself. You inhale to open. One more. Stay here, turn your palms up, look across the room 2/3 of the way up the wall, push your hands back so that they are behind your body or moving towards behind your body, and look up to where the wall and the ceiling meets. You're gonna feel tension in your upper back and neck. This is strengthening postural muscles in the back of the body. Palms are up, flex your hands strongly. You'll feel the stretch over your wrists. Doing as much stretching as we can here with this warm up. Take one more breath and then bring yourself down. Let's bring one hand up, reach with your fingertips first, and then the other side. One hand down, one hand up. Feel the lengthening and the stretch in the midsection, right where the lower ribs and the top of the pelvis meet. Inhale up and then bring yourself down. The next time you come up, flex your wrist. And then flex the other wrist. Keep your hands flexed. Keep your arms alongside your body as close to the ears as possible. Don't let the arms float in front of you. Gaze is up straight in front of you. Do not round your upper back and neck. And then bring yourself back down. Take your shoulders forward, up, back, and down. Tension, stretching happening there. Now bring yourself back to center. I want you to widen your base. So we're strengthening our hips here. So the hip joint is taking the weight of your body, strengthening our spine in this position, strengthening our hips in this position. So come into a pretty wide stance here. We're gonna move into rotation, and we want the rotation to be safe. So that wide base you're establishing with your pelvis here. If you squeeze your tushy cheeks, you'll lock your lower body into a more static or a held non-movable position. So I want you to let there be fluid here. Let this move a lot. So you move side to side, kind of like you're doing the hula side to side or a figure 8 with your hips. And then bring yourself with your hands on your hips. Bring your hips forward, your pelvis forward. Bring it to one side. Bring it back. Bring it to the other side. Forward, side, back, side. Forward, side, back, side. And then turn this into a circle. Notice if you're going in a clockwise or a counterclockwise movement pattern. Keep your head lifted. And then one more. And then bring yourself back to center. You're going to go forward, other direction, back, other side. And turn that into a circle. In the hips, rolling around in the hips. Knees are getting some action here. If the knees are not happy, maybe being a little bit closer may be better for you. So see what feels appropriate, or of course, extra padding if you need that. And then bring yourself back up to center. We're going to add some rotation. We brought some fluidity here. So with rotation, let your body move in whatever way it will. The one thing I want you to pay attention to is your elbow, because if your elbow is elevated and goes back, it'll take the shoulder blade, bring it onto your spine, and bring rotation to the upper trunk and to the upper part of the spine. So take your elbow, inhale, let your head follow, and rotate in one direction, and then exhale back. Inhale and exhale. Inhale, exhale. Go slow. So elbow lifted if that's okay for the shoulder. If shoulder's not happy, stay down low here, right around heart height. You can start to go a little bit bigger, letting it be the elbow and the hand. One more. And then bring yourself back to center. Let's take a break. So if sitting on your heels is appropriate for you, take a rest on your heels or stay elevated if your knees don't bend. Close your eyes. Bring your awareness inside your body, noticing whatever it is that you notice. Body awareness, really important for keeping yourself safe when you're practicing yoga. And then take one more breath. And then open your eyes. So focusing on joints, let's focus on the spine and the hips. This next posture that we're going to do has to do with the whole front body, all the muscles, making them as strong as possible. And it's really tremendous for hip health and for spinal health. So we're going to do plank. And I'd like to do plank in the forearm variation. So taking your block. So I'm going to hold this for a minute, and maybe that's okay for you and maybe not. I'd like you to count your breaths so you can get a gauge for what a minute is for you. Your elbows go underneath your shoulders, not out to the side. So we want to fortify the shoulder girdle, which is part of posture and alignment and spinal health and fall prevention and healthy aging and healthy, nice looking aging versus rounded body. So keep your elbows underneath your shoulders. Walk your knees back on your mat and on your blanket. So on the blanket, if you have a blanket, or if you're no blanket, on the mat, and push your block forward and start to bring your body down so that you come closer to the ground, and then make sure that your elbows are underneath your shoulders. So if you're gonna do the modification, you could keep the knees on the floor. And if you're gonna do the full variation, lift your knees off the floor. So you decide, you could have your tushy a tiny bit higher than your head and bring your awareness to your feet. Make sure that all 5 toes on both sides are pressing into the ground and you're pressing through your heels. And then bring your awareness up to your arms. Press your elbows, your forearms, and your hands into the floor. Press your pointer fingers into the block. Pushing your hands into the floor, your feet into the floor, and through the heels. On your exhales, activate your core. Zipper up the jeans on the exhale. Inhale to soften. Exhale to zipper up the jeans. This is isometric. The muscles are in their natural state, most of them. The whole center midline and the hips. Take one more breath. And then let your pelvis come down. Keep the block where it is. Make sure your elbows are underneath your shoulders. We're going to go right into what's called Sphinx posture. And we're going to work the whole time in this. We're strengthening the back. So you can take your feet a little bit wider than your body to protect your back. Make sure all 10 toenails are touching the ground. You can push your feet into the ground. The knees will lift off. And then squeeze your tushy to pull your tailbone down. That'll help to protect your low back. Let's begin this posture. Push your arms into the ground. Push your hands into the block. Push your belly towards the floor. Push your heart forward and lift your body up. This is a back bend, Sphinx posture. Feet in the floor, knees are off. It's active. Push your pubic bone into the floor. Squeeze your tushy to release that tension in the low back. And then push your belly towards the ground. Feel that stretch. Try to draw the ribs away from the floor and push the heart forward. Push your forearms into the floor. Push into the block. So create tension the whole time, not just hanging out here. Creating as much tension as you can, pushing away, pushing forward, squeezing the buttocks, belly, breathing down to your belly. No collapse. Slide the shoulder blades forward or towards each other, and then let them push forward to push your heart. Push away. Nice posture here. Take one more breath. And then go ahead and release. Some of these postures will hold for a minute. Some of them different variations of that. Timing. And then take your pelvis onto the blanket. Take your elbows wide. So let's get a little relief to come into the shoulders and into the back. Let your forehead rest on the back of the hands, and then wiggle your body side to side. Let it be really soft so that you let the bones settle in the soft tissues. And then breathe down to your belly, low belly, and this will help to relieve low back tension. Take one more breath. So we're going to come into locust. So you want to walk your feet together, big toes touch, the rest of the 5 toes touch the floor, soles are up towards the sky. Take your arms down alongside your body. Lift your upper body off the floor, lengthen your upper body as much as you can, and then let the forehead touch the floor. Exhale. As you inhale, let your nose feel like you're pushing a marble away. Let your neck bend. Start to peel your upper body off the floor. Lift your arms off the floor. Palms face each other. Fingertips are away. And then lift the legs off the floor. Rolling the inner thighs up towards the sky in a little internal rotation. Squeeze your tushy here and pull your tailbone down. And push your pubic bone, which is the bottom part of your torso, into the ground. And then push your heart forward. Bend the upper spine. You could keep your hands here. You could clasp if your arms are able to come away from your body. Slide the shoulder blades towards each other, whichever position you're in, and then push your heart forward, really bending that upper spine. Reach long with your legs, long with your arms, long with your head. Feel the pubic bone pushing in. Now we're strengthening the joints of the spine. Reach long with your limbs, long with your body. Slide the shoulder blades towards each other. Push them forward. Can you get a little more back bend? Take one more breath. And then slowly bring yourself down. Take your hands, fold your hands, spread your legs as wide as your mat. Let your forehead rest, bend your knees. Soles of the feet are reaching up towards the sky. And you're gonna let the weight of your legs just flop side to side. Not trying to push your feet to the ground or let them get too close to the ground. Just let the weight go side to side, releasing the low back. Bring your legs to the right off your body and slowly let one foot at a time move up and down from the floor. Trying to touch the floor with one foot, your tushy with the other. This is moving the knee joint, stretching the front of the foot. Then let both legs rest. Bring your arm up and roll onto your side. Knees pretty high towards your chest. This gives relief and release to the lower back. Take your hand on the floor in front of you and then push yourself up. So we're gonna do another back bend. We're gonna do bridge pose. We're gonna do it differently than we've done in the past. Maybe something you've done before, maybe not done before. Let's see. So you're gonna take your blanket to almost the top of your mat. So you're gonna leave this space for your head. So the blanket, you could use one blanket or even two folded. Better to have a thicker surface. So if you have towels that are thin, get two of them. Your head is gonna go on the mat and your upper torso or your rib cage will go on the blanket. We're gonna come into the bridge pose. So place your blanket on the ground. When you come down onto the ground, it's with that core contraction. So you either are gonna hold on behind your legs, or you could go down without, coming down onto the ground so that your whole torso is supported. So feel the edge here near your shoulders. So the edge of the blanket, the edge of the shoulders. Lift your head, lengthen your neck. And then bring your arms down alongside your body. Walk your feet closer to your body. Hip distance with your legs. Knees are pointing up towards the sky. Press your arms into the floor. Lift your rib cage and slide your shoulder blades towards each other. And again, correct the head position. Chin towards chest, neck long. Push your feet into the floor. Tilt your pelvis backwards to flatten the low back and towards the floor or the blanket. Exhale and inhale. And on your next exhale, push your feet in, squeeze your tushy, start to lift your body away from the floor, or rather push away from the floor. Feel your low back come off, feel your rib cage come off,
And then move side to side so you narrow the space. The weight is in the upper back area, not in the head or neck. Your head and neck are nice and long. Using your arms to press into the ground to lift your torso, lift your pelvis. You could have bent arms, you could have straight arms, or you could clasp your arms, sliding shoulder blades towards each other even more. Whatever works for you. Make sure your knees are not opening to the side or going in towards each other. They're reaching away from you to unbend your hip joint. Push your pelvis up, push your feet into the floor, squeeze your tushy, and then bring your awareness to your arms. Really push your arms into the floor so that you could lift and bend your torso, your spine, and your thoracic spine with your rib cage as much as possible. Close your eyes. Try to push the back of the spine into itself. And at the same time, you're lengthening the front of the spine. You might feel this over your knees. You may feel this in your buttocks, in your legs. Try to push your arms in and bring some of that to the upper spine. So this is a back bend bridge, strengthening the posterior chain muscles. Some of them are contracted, that concentric, the upper back, strengthening your postural muscles. Push your arms in, push your feet in, squeeze your tushy. Take one more breath. When you come down, go slow. So first, let your upper body start to come down. Lift your heels off, so come onto your toes. You'll get more freedom in your body. Feel the spine pressing down to the blanket. Tilt your pelvis back. Try to let the whole rib cage touch the floor before then the top of the low back touches. Feel that stretch that's happening with the heels up. And then let your whole body go down. Walk your feet a little farther away from your body. Couple of breaths here, hands on the belly. You could, at this point, let your head go side to side. And then bring yourself onto your side. Take a couple of breaths here. That was a long bridge, a lot of posterior chain work, strengthening hip joint, spine, really great spinal strengthener. Then take your hand on the floor and bring yourself all the way up. And then come to sit on the blanket. Bring the soles of your feet together, stretching those adductor muscles, those inner thigh muscles. And noticing throughout the practice how you're feeling. So definitely longer holds. It's going to be more joint strengthening work and making sure that that feels appropriate for you. And bring yourself out. So we did the plank, which was the anterior or the front body. Now we're going to do reverse plank, holding this for a decent amount of time. Let's see how we do, because it's a pretty challenging posture. So have your hands on the blanket. Fingers are facing towards you. And if the wrists are not happy, you can move your arms out. But what we really need is to support the upper spine and not let the upper spine cave in or collapse. So you want your hands close together so your shoulder blades can assist you. Take your legs straight. Let your legs touch. Shoulder blades towards each other. Lift your heart. Spread your fingers and press the fingertips into the floor, not just into the wrists. Take an exhale. And as you inhale, push your heels into the floor and lift your pelvis up off the floor in a reverse plank. Make sure your fingers are pressing into the ground, really stretching the front of the body, strengthening arm muscles, shoulder muscles, lots of tricep work here, pushing away, strengthening those pushing muscles of the back of the body, isometrically strengthens and supports your spine, your postural muscles, your alignment muscles. Push your feet in to lift your pelvis up. Largest bony structure in the body, pretty hard to push away from the ground and to support the weight of the pelvis. Lift your heart, stretch your heart. You could look straight up towards the sky and add that upper back and neck strengthening. And if your upper back and neck are not happy, you could tuck your chin towards the chest. So do what's appropriate for you. One more breath. And then slowly bring yourself down. Come into a rest position. Catch your breath. Close your eyes. Sit nice and tall. Let your awareness go to wherever it goes in your body. Take one more breath. Go ahead and open your eyes. So most of these postures we're holding today are at least a minute, which is a challenge. And when it comes to muscles, there is a phase at which we can strengthen our muscles. It's anywhere from 8 seconds to 72 seconds. So that's 8 seconds to a minute 12. And once we get to that minute 12, there's a refractory period that happens in the muscles. So the good news is that a minute or even a minute 12 could be a nice maximum place to work into. And the longer you practice, this is where you'll notice that strength develops, is in the joints. There'll be more stability, less shaking, more of strength feeling when you're doing these stability type postures. So the next one we're going to go into is going to strengthen our side body and the spine. And this is a modification of a side plank. So it's actually manageable. It brings in though balance, strength, and flexibility. So it can be challenging. Yet for many, this is a much easier position than being in a side plank. So have your blanket and get your block. And you're going to come first onto all fours. So have your feet on the toenails or on the ground, have your block handy here. So let's all go to the same side. Easier to instruct and for you to feel this in your body. So take your left hand directly underneath your left shoulder. Spread your fingers and point your finger forward. And then keep the left knee on the floor, but slide the left leg off to the side. So we're sliding the leg off to the side. And that is your kickstand. And then bring the block into your right hand, bring it in front of your pelvis, come to your fingertips, and you're going to open your body up to the side. Bring your foot on the floor alongside your body, and then bring your hand up onto your waist. Now, make sure that your foot's not forward, because if it is forward, it's going to be hard if you want to come into the next step, which is to lift your leg up. Lifting your leg up at body height, and then bring your arm up into the sky. So this is a balancing half moon, strengthening the side of the hip joint and strengthening the side of your spine. Keep your hand up. Now keep your leg lifted. Keep that foot active. So reach through the heel of that leg and then get as long as you can on the top side of your body. So reach through that leg, keep that leg lifted, leg is straight, your arm is straight out of your shoulder, and then push your arm back. That'll help to bring that shoulder blade there to help support you. And then lengthen your spine, lengthen your torso, flexing the foot, reach through the heel strongly. Hips are pointing forward, heart is pointing forward. Take one more breath. You're going to dismount gracefully. You might notice there's tension in your neck here, strengthening the side of the spine, the side of the neck. Bring yourself all the way out. Let's take a break from one side to the next.
Sitting on your heels if you can, closing your eyes, catching your breath. And then go ahead and open your eyes. So we're going to come to the other side. Get your block. Bring your block to the other side. So the blanket is underneath your knees, and that will actually help to support the weight of your body on your knees. And of course, anything else you need to add, do so. It's your practice, so make it very individual to yourself so that it's manageable and what you need it to be successful. So take your hand underneath, your right hand underneath your right shoulder. Slide your right foot off to the side and bring the block right about belly height or pelvic height. And then you're going to open up so that your foot comes on the floor alongside you. And then bring your hand up onto your waist. From here, if you could come to the next level, you would reach your leg up at body height, reaching through the heel and bring your arm up. Straight up. So there's a balance here. Your hip is managing where is your body weight in space. The lifted leg, you are strengthening the upper, well, the whole entire spine on the side, but you're getting that upper hip joint or that side hip joint strengthening. Lift that leg, that's weight bearing against gravity. Your hip is doing that, the muscles of the hip. Reach your hand up and reach your hand back. So you manage the balance aspect of this. And you can push your leg back as well, so it's coming straight off your body or slightly to the back. And then feel and notice what you notice. You're balancing on that standing hip, so you're strengthening that hip in the joint, compressive force. And then the lifted leg, you're strengthening the muscles of the side body. You're also strengthening your side neck, keeping your head in this position. So if your head starts to get too much tension, you could look down slowly towards the ground. Reach through the heel of the leg, keep that leg straight, long spine, body turn forward. Take one more breath. And then dismount gracefully. Come all the way down, close your eyes, catch your breath. And then go ahead and blink your eyes open. So a lot of spinal work so far. Let's do a twist to kind of take some of that tension out of all the back bending that we did in practice so far. So take your blanket to the top of the mat. Fold it. Depending on how tight you are in your hips, you may need to have an even higher fold or be on a bolster or pillows. And wherever you are, you want to come to the front, reach back and get the flesh. Pull the flesh back so you feel the bones exposed. Then bring your block onto the left side. Legs are straight, and then you bend the left leg. Right leg is straight, left leg is bent. Hold on to your left leg, elbows are elevated, and pull your body closer to that leg. Then hold on with the right hand to the left leg. Take the left hand either on the block behind you or the floor. You're not leaning on it, you're pushing away from it. You want to grow straight out of your pelvis. So active right leg, active left foot, active right elbow. Exhale, and as you inhale, push away from the floor with your hand on the block, with your legs, and then turn the lower ribs, the middle ribs, and the upper ribs deep into rotation. Keep pulling your torso towards your leg, lift the right elbow, pull the right toes towards you, push the right foot into the floor, push the left foot into the floor. Now lower the shoulders, slide the shoulder blades towards each other, and push the shoulder blades forward to lift your heart. Feel that stretch in your torso. Lower the shoulders, slide them towards each other, and lift your heart. Keep your right elbow lifted. Push your right foot into the floor, your left foot into the floor. Then chin is parallel, push your head back, lower shoulders, shoulder blades towards each other and forward. Lengthening, rotating, and bending the upper spine as much as you can. Active right foot, active left foot. Take one more breath. With length in your body, you're going to lengthen up and out. Push the block to the other side. Keep your torso long as you straighten your left, straighten the left leg, bend the right. Hold on and pull your body closer. That'll bring your spine up. Hand on the block on the floor behind you. Left elbow is elevated. Pull your torso closer to that right leg. Then you're going to push down with your limbs. Exhale. And then inhale. Lower ribs, middle ribs, and the upper ribs. Push your left foot into the floor, left leg into the floor, right foot. Keep that left elbow elevated. Pull your torso closer to your right leg. Push away from the floor with your right hand and then lower your shoulders. Slide the shoulder blades closer to each other and then press them down your back and forward to lift and add a back bend into your spine. Push away from the floor, lengthen your torso, rotate your trunk. Lower your shoulders, slide your shoulder blades towards each other. Push them forward, lift and lengthen your torso. Lift your left elbow, press your left hand into the floor, or left leg into the floor, left arm is raised, push your right foot into the floor, pull your torso closer to your leg, rotate. Take one more breath. And then with length, you come forward, you bring yourself out, you take your legs long. And if you want to bring your body forward to get a little release, or you stay here with wide legs, letting whatever's happening happen. Take one more breath. And then let's move towards standing. So we're going to need a strap, either with a loop or regular strap or towel, and you're going to need your block as well. Bring your blanket onto the ground. We're going to come up through a down dog or a variation of down dog, strengthening the hip joints along the way. Take your hands wide, take your knees wide, take your feet wide. Flip your toes under. And then push your body weight back, lift your pelvis up, your tushy up. Really deep hip flexion or hip bend. And your head is forward looking where your thumbs are. And then try to push one heel towards the ground at a time and try to make it be the outside edge, the pinky toe edge that's pushing towards the floor. Keep your head forward, strengthening your neck, your upper back, your posture muscles. Spread your fingers, push your fingers into the floor. Push both feet down, push your kneecaps back. And then bend your knees deeply and walk yourself back. Make sure you do not come up. We're not coming up yet. So let your heels touch. Now your feet are on the mat. And if they're not as wide as the mat now, walk them wider. Wide, wide, wide. And then take one arm at a time up on top of your thighs. You're not resting here. You're pushing away. You're in your glutes. You're in your knee joint, your hip joint. A little extra would be to bring your arms forward, push your body weight back, or stay with your hands on your thighs. Look forward. Don't let your head look down. There's tension in the upper back and neck, strengthening posture. Bring your hands together by your heart. Push your hands together and then slowly unload out of your hip joint. to come up to standing. So we'll clear our space, bending at the hips to clear your blanket off to the side. And then let's come into a chair posture. So take your strap and your block. Bring your block in between your knees, and your strap either goes onto your hand or your wrist, or if you don't have a loop, you just take it and pull it apart. So whatever it is you're going to do, take your feet block distance, squeeze the block. You can put the block at the thighs or the knees, depends on your body. Choose what's right for you. Bring your arms forward and then slide your shoulders deep into the socket. Push your tushy back, bending into chair like you're sitting back on a chair. You don't want your knees to go forward. Look down, you should see your whole top foot, and lift your toes off the floor. And then when you're here, lift your arms up. So the torso is lifted and the bend is mostly in the hips and some in the knees, but mostly in the hips. Push out on the strap. Then squeeze your tushy, pull your tailbone down, try to flatten out your low back. Squeeze your block. Reach up, look through your fingers, push out on your strap. Deep breaths here in chair, strengthening your hip joint. Take one more breath. And then you're going to bring yourself up and out. Take your strap. Take your block off to the side. Find mountain, alignment, a place to rest, a place to find alignment in your body. Hands are down, back, toes are touching, pinky toe edges are pressing into the floor, heels are pressing into the floor, top thighs are back. Push your head back on top of your spine, chin parallel towards the ground, hands are back. Take one more breath. So we're going to do the warrior two posture. This is going to load us down into our hip joint a lot. So a lot of hip joint stimulation, holding all of those muscles, some lengthening, some contracting to maintain the strength in our joints. So get a chair if you need a chair, a wall if you need that, whatever it is you need, get whatever you need for yourself. And then we're going to go into a wide-legged position. From here, keep your legs straight as you swivel on your heel to move the heel away, or the toes away, and then the back heel away. Put a slight bend in that front knee. Take your backhand on your thigh. Exhale. As you inhale, slide that backhand down the leg. That's what's bringing that bend into the front leg. When you get here, set up your feet. Pinky toe edges are pressing into the floor. You're lifting your arches. Shoulders are forward, up, back, and down. Then bring your hands up. This is the warrior two. Reach back with your backhand. Make sure your torso didn't go forward. Push away from your back foot to go deeper if that's appropriate. Squeeze the tushy and pull the tailbone down to minimize the low back curve, to take too much tension out of that low back. The lower you go, the more work you place in that hip joint. Push your hands back, shoulders down, slide shoulder blades towards each other, and then push your shoulder blades forward to lift your heart, to bend your upper spine. Push your front knee to the side, the direction that you're in, so you don't let your knees collapse towards each other. Feel like you're pushing your knees away from each other. That'll give you a little freedom in your pelvis to point your tailbone down. Bend that joint a little deeper if that's appropriate. Back leg is straight. Push the pinky toe edges into the floor. Take one more breath. And then bring yourself up and out. Toes are forward. All that tension, strong front hip joint there. Let's let the opposite toes move away, heel move away. Get your feet established, so those pinky toe edges Back hand is on the back thigh. Exhale. And as you inhale, slide the back hand down the leg. Let the front leg bend, coming into the warrior two. From here, lifting your arms up. Reach long with your fingers, shoulder blades down, shoulder blades towards each other, and press them forward to lift your heart. And then refine the posture. Pinky toe edges, arches are active. Feel like you're grabbing the floor. Can you bend that front leg a little bit more? Squeeze your tushy and pull your tailbone down. Feel like you're ripping the floor apart. Bring your awareness to your feet and feel like you're pushing them away from each other. And that'll free up that tension in your pelvis. Push your hands back, lower your shoulders, shoulder blades forward and up. Lift your heart. Deeper. Can you go deeper? Push that front knee to the wall. Try to push the knees away from each other. Active glutes, active leg muscles. Reach long, reach back, and reach up. Take one more breath. And then bring yourself out. Come to a mountain to catch your breath. So if you're able to stay the whole time in these postures, about a minute in these standing postures, great. And if you need to do less, do less. So the next one we're going to come into is another deep bend. We're going to add rotational force to the spine. This is side angle. So we're going to strengthen the joints, the muscles of bones, and put that torquing action on the spine to add some strength there. So you may want to use a block. Put that there on the side we're moving in. Coming from a really wide stance, preparing your legs, toes away, heel away. Start putting a bend in that front leg, hand down the back leg. You're going to inhale into this. So loading up, coming into the warrior two, then reach long. Bring that forearm onto that front leg to begin. And establish the base here. Establish those pinky toe edges. Lift the arches up. Grab the floor with the toes. If you're able to come down, bring the block right in front of your leg so that your straight arm goes on that inner knee joint. Then you could push that inner knee back. Feel that deep stretch in the adductors, the inner thigh muscles, pulling on that pelvis and compressing that pelvis into the joint, the leg bone into the pelvis. Strong hips. Rip the floor apart with your feet. Go deeper if you can, long torso, and then rotate your trunk up towards the sky. Lots of stretch on that adductor. Long torso, rotated torso. Take one more breath. And then bring yourself through the warrior two and up and out. Lots of work for your legs today. Get your block to the other side. Toes are forward. Toes move away. Heel moves away. Bend in the front knee. Back hand on the thigh. Exhale. This is what loads you down into it. Sliding your hand down that leg. From here to the warrior two. And from here to side angle. You're not resting here. You're pushing away to keep your trunk away from your leg and lengthen. If you could do your hand on the block in the front of the knee joint, pushing that knee away, then you're going to get that deep adductor stretch. Great for hip joint health and knee health. So thinking about our joints from preventing breakdown for knees and hips. Lengthen your torso and rotate up towards the sky, adding in that torsion or that torquing action to the spine. Rotational forces to pull on the vertebra to create stronger bones. Lower down if you can, lengthen, rotate, squeeze the buttocks, pull the tailbone down. Active feet, active arches. Take one more breath. Push your feet into the floor, bring yourself back up, bring yourself out. Come into mountain. Take your legs not too far apart, but sway your hips side to side. And let's do that circle. Bring your hips forward, to the side, back, to the side, forward, side, back, side. This is a hula hoop action. Rolling around in your hip joints. Take that tension out of your body. Let's go the other direction. Bring yourself back to center. A lot of tension created. Let's release that with whoosh, really accentuating the SH sound. So grab whatever it is, whether you know what it is or not, grab whatever it is that creates tension, and it could have been the practice today. Take a big inhale. Two more. Inhale to the sides. Hold. And one more. Grab, grab, grab. Hold it tight. Inhale. Let it go. Shake your limbs. We're going to come down and do the Shavasana. An amazing posture for integration to allow everything to integrate back to where it needs to go. So I have a wall. I'm going to do legs up the wall. You choose what's appropriate for you in your practice. Go ahead and get whatever you need. So to get down to legs on the wall, you want to start with your body as close to the wall as possible, and maybe even a little angle, let your tushy touch the wall. As you come down, you want to push your body towards the wall, bring yourself down, and then you bring your legs up. So your body may not always touch the wall. That's okay if it doesn't. Just be as close as your muscles will allow. Then take your arms out to the side or on your belly, or coming into any form of Shavasana that you'd like. This is an integration. Stay here, stay in the moment, stay with your breath. Gently begin to deepen your breath. And start to move your head side to side. Move your hands, your toes, your feet. Then draw your knees into your chest. Have your knees be a little wide and pull them towards your armpits. Let the soles of the feet go up towards the sky. Moving side to side, massaging your back. Coming onto your side, and from there, pushing yourself up to a seated position. Coming into a place where you could close your practice with a humming sound. Bring your hands together and then to your heart. Press your heart to your hands. Feel that lengthened feeling in your spine. Let's bring sound up and down our spine. Calm and settle whatever needs to be settled. Exhale. Inhale. Bringing your hands up to your forehead, bowing forward in Namaste. This practice definitely was a challenge, and so making sure that you do what's appropriate for yourself. One thing I will say, and what I've noticed over the years, is how strength all of a sudden sneaks up on you. And you might not notice it as it's happening, but after a few months or years of practice, you start to feel this strength. And with that strength, especially in your joints, comes confidence. And with confidence comes movement. And with movement comes stimulation to your muscles, your bones, and your joints. Use it or lose it. Practice as often as you can, and for the rest of your life to stay strong, happy, and healthy. All right, I think I'll be sore. You might be too. One of the places you may notice this tomorrow is your triceps, especially if you did the reverse plank for the whole minute that we did. I felt it while I was doing it. I'm sure I'll feel it tomorrow. Lots of posture work today. How was that? Yes, challenging. Wait, where's the water, Shizue? I like when you do the little moisture droplets because we're creating moisture for sure when we do this as well. All right, any questions, comments? Yes, Jean, that's what we want, right? Yeah, I'm going to feel this tomorrow. And I feel so strong and I love that. And that's what I want for you as well. So, all right. Well, have a lovely weekend or the rest of your day or whenever it is you're practicing. If you're live, it's the rest of the day and a weekend. Yet when you watch us recorded, it could be anything. So whatever it is, happy whatever. All right. Bye.